Welcome to the Upper Shore Community Mental Health Center. I am Lori Lowry. I'm the management associate. I didn't get a new thing, and I'm also the volunteer liaison. How many of you have been active in the push to keep Upper Shore open? All right. How many have been here before? Okay. It's a multi-purpose building. Over to the right, on the other side of the wall, is the outpatient mental health clinic, which is very convenient because it's always nice to see that the patients who were once here are keeping their clinic appointment, keeping up with their meds and things like that. The center opened in 1982. We have been here a long time. We have been through so many things. We have changed with the times. We have not been one of these facilities that just keeps everything the same. One of the things that we have done, besides the dual diagnosis unit, we've had drug studies here, blind studies here. We have catered to what our patients need. And the unit staff has been so cooperative and so willing to learn. We are an educating facility. We've had nursing students in here. We've had psychology interns in here. I used to coordinate a mental health from Talbot County, a student program for the summer. And it's just anyone who wants information, we're more than willing to give it. We have great ties with the community, as you all well know. We now have 20 beds on each unit. Census is almost full, I think 18 and 19 or something like that. Our patients come here through the emergency room. That is the only way they can get here. And the reason for that is we need to rule out anything that might be medically wrong. We use seclusion and restraints very sparingly. A few years ago, we decided we wanted to, kind of cut down on that, and then the national trend was to cut down on it. So we do use, a checklist, a step to try to, calm them down so they don't end up in seclusion. And when someone ends up in seclusion, after they're clear and come out and relax, we have a post-seclusion checklist. What can we do next time so you don't end up in seclusion? Okay, we get patients in here sometimes who have nothing at all, no money. The CEO, the administrator at the time, was Dr. Harold English, and he wanted to get community involvement, people close to their homes, so he was the father of the Upper Shore Hospital. He and Dr. William Tubman, who was our first administrator here, were here when this was just a cornfield and there was an airstrip over there and nothing else except the plaza. That was it. So the town has moved out to us. We were in the middle of nowhere when we first opened up. And again, his philosophy was open door. Don't treat people as if they were animals and they won't act that way, which is remarkable.